Hi, I'm Shelby Rivers, and I'm going to share a little more about my SPSP 2021 poster, Social Relationships and Patient Perceptions of Adherence to Type 2 Diabetes and Hypertension Treatment, a longitudinal study. So the overall goal of this study was to identify factors likely to produce within-person change in three consequential categories of patient adherence perceptions: self-reported adherence, benefit attitudes, so how useful and necessary is the treatment, and burden attitude, so how unpleasant and distressing is the treatment. And the key idea expressed in the literature is that these types of adherence perceptions should shed light on underlying adherence processes. Importantly, most models of adherence in hypertension and type 2 diabetes have focused primarily on medication and on factors likely to produce short-term within-person change in medication adherence. But we wanted to identify factors that were more likely to have broad relevance to the entire treatment regimen. So in order to do this, we proposed the model, which you can see here in the middle panel. And there were three specific aims associated with testing this model. So first, just looking at those total and unique aspects of the associations for each social factor. So the patient-practitioner relationship factors, and then close interpersonal relationship factors with each adherence perception that I outlined above. The second was to examine within-person effects and differentiate those from contextual effects using multi-level structural equation modeling, which I'll talk about more in a second. And then third was to determine whether any of those within-person effects were mediated by the role of subjective stress or whether those were direct effects. So as mentioned in the poster, we recruited 167 people from Amazon Mechanical Turk in order to take 6 monthly questionnaires. Now I want to really expand upon the statistical approach here. So this used multi-level structural equation modeling. If you're familiar with multi-level modeling, it's a similar technique except it uses latent decomposition, which can give it slightly more accurate estimates of the effects, particularly at higher levels. So the goal of this approach was to decompose within-person associations from more stable contextual associations. Because if we're really trying to pinpoint the types of associations that are most likely to be important for informing our day-to-day adherence, attitudes, and behaviors, it's important to examine those that are showing these patterns of within-person association. So what did we find? It's a lot to go over in this short video, but I do want to draw your attention specifically to that within-person effects table. So we found that all 5 of the factors examined here, so 4 social factors, 2 involving the patient-practitioner relationship, so we had patient perceptions of alliance or a warm and trusting relationship with the practitioner, and patient experiences of confusion, lingering questions, and negative feelings, as well as the 2 dimensions of patient interactions with close others, so positive interactions that promote support and intimacy, and negative interactions characterized by criticism and withdrawal, as well as experiences of subjective stress, were all associated at the within-person level with either perceived adherence or perceived benefit, although notably no variables examined in this study were associated with perceived burden. We also tested those mediation paths, and we found that only negative interactions showed any type of indirect effect at the within-person level for both adherence and benefit. In follow-up models, we also tested full models, so examining all of these paths simultaneously, and most of them did remain significant. So I've bolded the ones that remain significant, and regarding those indirect effects, only the path from negative interactions to perceived stress to adherence remained significant in the full model. So in conclusion, social relationship factors may be a powerful and plausible mechanism for affecting patient perceptions and attitudes toward adherence, and potentially toward improving adherence to treatment in type 2 diabetes and hypertension. Obviously, further research needs to be done, including testing interventions that actually manipulate these variables and examining the expected temporal precedence, as these within-person effects are cross-sectional at each time point and not lagged. We did test some follow-up models that I'd be happy to talk about regarding lagged effects, and I'd also be happy to talk about how the COVID-19 pandemic may have affected these results. Thank you.